You cannot change the world, but you can surely change someone's world. A very hearty good evening to all the dignitaries, guests, and delegates present here. I feel privileged to extend my warm welcome to all for the opening ceremony of the National Social Summit 2021. The happiest people we know are those who lose themselves in the service of others and discover their own life and happiness in the process. Right through the idea of having an annual social festival back in 2016, we have indeed come a long way as we have gathered today to inaugurate the fifth edition of the National Social Summit. With the aim to inculcate a social culture by coming together and working to empower the fire of innovation among young minds, it aims to connect them to the expertise and proficiency of the leaders in those fields to support the upliftment of the society, bound to the aim of NSS in the long run. In order to fortress its revered vision of curing indifferences, Team Social Summit believes that social integration is indispensable to create an inclusive society. Thus, they devise a sustainable solution model to the social problems, engaging the community and the stakeholders, creating a general sense of responsibility and awareness in the society. The two-day extravaganza from March 27 to March 28, 2021 is organized by Team NSS IIT Roorkee. NSS, National Service Scheme, as all may know, is a public service program aimed at education through service. With the motto of "Not for me, but for the nation," NSS IIT Roorkee has aroused the awareness of the realities of life and better appreciation of the problems of the community that surrounds them, while keeping up the ideas of democracy, nationalism, secularism, and development of scientific temper through their actions. This year, the summit comes as a tribute to our frontline responders and medical personnel for their immeasurable contribution to annihilate the coronavirus pandemic. The global crisis has caused all of us to witness this summit virtually. But with the support and guidance of the World Health Organization Country Office for India and under the patronages of UNESCO and Niti Aayog, we have been able to make it possible. Having said that, we announce our very theme for this year, Envisioning Better Healthcare Evolution. As we declare the National Social Summit 2021 open, I am profusely elated to introduce our chief guest for the day, Dr. Rodrigo Offren, WHO representative to India, Dr. Raman Ganga Khetkar, former Deputy Director ICMR, and Dr. Randeep Guleria, Director AIMS New Delhi. We are also delighted to welcome Professor Ajit Kumar Chaturvedi, Director IIT Roorkee, Professor Manoranjan Pareda, Deputy Director IIT Roorkee, Professor Mukesh Barua, Dean of Students Welfare, and Professor Anil Kumar Gauri Shetty, Associate Dean of Students Welfare, IIT Roorkee. On behalf of the whole IIT Roorkee community, I thank all our esteemed guests for providing their gracious presence to this event and join us today to enhance our joy. Their excellence and distinguished work in numerous capacities has volumes to impart to us this evening. To add to it, Team NSS IIT Roorkee is the largest student body group on the campus. Leading a team of 100,000 plus volunteers to give a new meaning to our social objectives is no easy task. As a team, we have been grateful to have a leader like Mr. Harkirat Singh Arora, the current General Secretary of NSS IIT Roorkee, pursuing his fourth year BTech in Chemical Engineering. On this glorious occasion, I would like to invite him to give his opening address. Over to Mr. Harkirat.
Yeah, thank you very much, Kavya, for your kind words. And again, welcome you all. Good evening to all the delegates, to all the participants, to all the esteemed guests, esteemed speakers. I am Harkirat Singh Arora, General Secretary at National Service Scheme IIT Roorkee, which is a student-run organization working under the edges of Dean of Students Welfare with the motto for not for me, but for the nation. We believe that each and every one of us has a light barrier to the society that is liberated from all the shackles of social problem. And as Kavya mentioned, we are a team of more than 1,000 volunteers striving for social upliftment, focusing on several important social issues such as education, cleanliness, environment, healthcare. In the past, especially before the COVID-19 pandemic, we have been working on several initiatives like Udbhav Shiksha Ki Nayumang, wherein we go and interact with the school students in nearby schools of our campus made them learn about new techniques apart from academics, make them the holistic development of their life cycle. Moving ahead, we worked on different initiatives like donation drives, wherein we collect the, you can say, waste materials, plastic materials, like books, and from the campus residents of IIT Roorkee and distribute among the needy. One more important issue which we have worked in the past is Swachh Bharat Abhiyan, the cleanliness Abhiyan, which we all know like how important the role environment plays in our life. But this thing every changed with COVID-19 pandemic, this lockdown, they shut down all the schools, all the colleges, all the institutes, life became to the halt. But NSS IIT Roorkee did not die out its spirit due to this lockdown. And I'm very proud to share that the very first event after COVID-19 lockdown reopens was not a virtual one. Indeed, it was a physical one. That was the blood donation camp organized in June 2020 at IIT Roorkee premises itself. The time when COVID-19 was at its peak, the time when everybody was fearing of this virus, this pandemic. In that very time, the NSS team was able to pull off organizing blood donation camp to collect the blood samples for the needy patients suffering from COVID-19. Moving ahead, when everything was at halt, we were not able to follow the normal practices we used to follow like each year. We need to find out different issues which we can identify, which we can work on. While deliberating, while discussing, we find that the past year has actually, you can say, actually made us aware about the importance of healthcare. When we see like which issues, which sub-themes we can focus in with respect to healthcare, we came across that with COVID-19, many people, they have suffering from mental illness. So let's work on mental health awareness. Let's make people aware about what actually mental health is. Let's make them aware about their well-being. We organized several events, several webinars, several quizzes, competitions as a part of World Mental Health Day celebrations in September and October 2020. Moving ahead, the emergence of COVID-19 pandemic also led to the emergence of a new interesting topic. This is called antimicrobial resistance. What if we are not able to curb antimicrobial resistance down? Will we see another pandemic? Inspired by this, we organized several events as a part of World Antimicrobial Awareness Week 2020 in collaboration with WHO Office, wherein we had the technical officer of AMR Lab and IPC, Dr. Anush Sharma, with us to share his views, to share his words of wisdom based on the antimicrobial awareness. In all this, COVID-19 pandemic, we forgot one major issue, that is road safety. Road safety is something what we call as a forgotten pandemic. The number of deaths caused by the road accidents is nearly equal to the number of deaths India has seen due to the COVID-19 pandemic till now in the past 1 year. But still the reception, but still the response of the society is totally different to these two issues. So we focused on organizing different events as a part of 32nd National Road Safety Month from January 18th to February 17th. Again, moving ahead with the after Road Safety Month, we checked with World Rare Disease Day. COVID-19 is a very common word. Everybody knows that because media is covering that. Everybody, the world is suffering from it. But there are certain diseases wherein they're not very common, which were obviously called as rare diseases. So we organized a webinar session on making people aware about what these rare diseases are and how these people who are suffering from rare disease should be treated well. They should not be marginalized from the society. They should not be marginalized from the community. But one thing which I've always faced as a student head, as general secretary of NSS, the people used to say, like, why are you working on some issues like healthcare? Healthcare is not a social issue. Healthcare is a technical issue, wherein we see whenever we heard of healthcare, we always imagine someone working in lab, making some new compounds, making some new drugs, making some new discoveries for treating different diseases and eradicating different microbes from this earth. But I would again assert that healthcare is what, according to me, is more of a social issue rather than a technical issue. Take an example of COVID-19. When COVID-19 emerges, the world was at shackles. They were thinking of what to do, what not to do. It was the society which played an important role by following social distancing. It was society which played an important role by washing their hands regularly, by staying at their homes, by obeying all the government regulations, not only in one state, not only in one country, but in the whole of the world. That's where the role society has to play in terms of healthcare. In terms of environment, if society starts respecting the environment, we won't require any technical interventions at large scale. The issue which I talked about, antimicrobial resistance, if society starts following the proper prescriptions given by their doctors, I think we can surely curb down the AMR, and we won't require any technical intervention for a long time. We can still, scientists, they can work on discovering new drugs, but they won't be having a shorter time period or short time span to discover. Moving forward, working on different healthcare initiatives individually, mental health, AMR, road safety, rare diseases, I would proudly say the National Social Summit is a culminating point of combining different sub-themes of healthcare, focusing on different sub-themes under one umbrella, National Social Summit, with the theme Envisioning Better Healthcare Evolution. What our vision for National Social Summit is to identify different issues, is to accelerate the innovations to overcome those issues. What we think is that as a part of this summit, as a part of these different competitions, we organized as a part of these different competitions, 5 or 6 years down the line, when people start discussing about a particular issue, then they should deliberate on the discussions which were carried out in the National Social Summit 2021. We have a competition, let's suppose, on policy-based competition on infection prevention and control. 5 or 6 years down the line, when the organizations, export organizations like WHO, ICMR, they start preparing policies for IPC, they should focus themselves on National Social Summit 2021 and find some ideas. And we can proudly say, and IIT Roorkee can proudly say, after 5-6 years, that the idea which WHO or ICMR they are following was once presented in this annual social festival. So finally, I would just say that the National Social Summit, the where we are virtually, the setup of the events would not have been possible without help of our partners. I with a special thanks to World Health Organization Country Office for India for the technical support, for the knowledge support, and for providing sponsorship to this event as well. Other partners like Indian Council of Medical Research, CTD-EP, Niti Aayog, UNESCO, etc. They have also played a very crucial and important role in setting up this National Social Summit 2021. Not taking much of the time, I, as General Secretary of NSS IIT Roorkee, welcomes you all to National Social Summit 2021, and hopefully the next 2 days will play an important role in the healthcare dynamics of a country like India.
Thank you so much, Harkirat, for your kind words of wisdom. As we would like to move forward with the ceremony, I would now like to welcome Dr. Ajit K. Chaturvedi, Director IIT Roorkee, for his address.
Thank you, Kavya. Thank you, Kavya and Harkirat, for giving a very nice introduction to our national service scheme, NSS. We often get confused with National Social Service. So I think you have given a very wonderful introduction and a background. And I am very delighted to welcome Dr. Rodrigo Offrin of WHO and Dr. Raman Ganga Khedkar, former Deputy Director General of ICMR. We have seen both these faces on the television. Today we are seeing them in our function. Thank you, Dr. Ganga Khedkar, and thank you, Dr. Offrin. We have a very interesting and very deep-rooted tradition of our students getting involved in the social sector, getting involved in the world outside. We don't believe that our students are complete with only education, with only technical education. So the institute encourages all kinds of extracurricular activities. And NSS is one of the pillars of those activities. And although it may appear that during this COVID-19 pandemic, we are doing more and more online events, but what makes me more proud is that our NSS group at IIT Roorkee does lots of physical events. And the two physical events that really stand out for mention today, one is the annual blood donation camp. In fact, every year I see that it either creates a new record or at least it does equally well as in the previous year. This kind of tradition is not easy to establish, but having put it, now our team gets energized that they cannot go below the previous year. So this kind of blood donation camps not only spread awareness, but the amount of blood bottles and blood donations that happen, they're able to save a large number of lives. So it is not only about spreading awareness, it is actually delivering something on the ground. Second thing that makes me happy is that our road safety week has now become almost a permanent fixture. Every year I see that our NSS team comes forward and does a very wonderful job. In fact, this year they went one step ahead and coordinated with our safety office of the institute to create more awareness in terms of road safety. And as it was pointed out by Harkirat, that the number of deaths that occurred because of road accidents is no less than any other major medical emergency such as COVID-19. Of course, this year physical activity have been slightly less, but then they have compensated for it by focusing on the mental health awareness issue and also on the antimicrobial resistance issue. These two things have done. So our students are at home. Dr. Ganga Khedkar and Dr. Rodrigo Offrin, our students are at home, but still they are active from their homes, most of them. And see, you can see how committed they are to these causes, and your presence energizes them even more, because we all want to hear from the wisdom of both of you. And of course, today we are also fortunate that Dr. Randeep Guleria, the director of AIIMS Delhi himself, will be here, and he will also deliver what are the lessons of that we have learned from COVID-19. COVID-19 has taught every sector, every human being something new. And I think the education sector has undergone a complete transformation. Our students are not in a happy condition because they have been confined to their homes for very long. I wish that we can quickly control this pandemic so that normal life can return. But the good thing is that despite the fact that we are not having normal times, lot of activities in the teaching domain are being done as if it is almost normal, which we know that it is not. So all that pain and suffering is on our students, on our teachers, but they are living up to the expectations. I would not take much time. Today is the day to listen to the experts. So I would hand it over back to Kavya, and then we would like to hear the speakers that have assembled today evening. Thank you, Kavya, and thank you, Harkirat. And of course, thanks to the leadership of Professor Rachita Gulati for having pulled this off. Thank you.
We humbly thank you, Professor Chaturvedi, for your kind words of wisdom. Moving ahead to our first guest of the evening, Dr. Rodrigo Offrin, who is a WHO representative of India and has had enormous experience in public health care. He has provided strategic technical guidance and operational leadership to the ongoing response to the global COVID-19 while being the Regional Emergencies Director for WHO Southeast Asia region. He has also contributed to several innovative measures for strengthening emergency preparedness and response in the region that was later replicated globally. He has given a fillip to the flagship program on reversing antimicrobial resistance, AMR, which was also one of the essential topics under NSS IIT Roorkee this year. With that, we invite him to address our audience. Over to you, Dr. Offrin.
Yes, thank you very much. First, to all of you for organizing this National Social Summit. It's actually, although Professor Ajit Chaturvedi was telling me that I can motivate people, I am more motivated by students who have prioritized in this event health, not just healthcare, but health. I guess there's no other time in history that we will be able to put the spotlight on health, its challenges, inequities, and possible solutions. So with that, maybe I would just like to start with my first slide. But first to say thank you, Kavya, for your kind words of the introduction. Mr. Harkirat Singh Arora is a very eloquent portrayal of where we are right now. the pandemic in India, and how we may all work together for the future, as the theme says, not for me, but for the nation. I think that's for every nation, and it's not for me, but for the globe, for the planet. Thank you, Professor Ajit Chaturvedi. Dr. Raman Gangakedkar, very nice to be in the same panel with you, very honored. Dr. Randip Guleria, be listening to you, and thank you to all the organizers, Professor Rajita, for putting this all together. My first slide, please. Maybe I'll just share my screen. Yes. So initially, I was trying to put a context and a title to the presentation, and I was given the task to, how do you say, look at the COVID-19 vaccination and COVID-19 vaccination. And that big challenge, and how India has been able to address that. But I thought it's a larger piece, and vaccination is just part of India's response to COVID-19, and there are great achievements but greater possibilities. And that speaks to the theme of envisioning for a better healthcare evolution of the National Social Summit. I know I'm talking to future leaders and change agents and current change agents of the National Service Scheme of IIT Roorkee, and we've been a partner with you for key health issues, recently AMR, of course. And from what I've heard is that there is a deep sense of equity, which is the theme of World Health Day, but it's also a core value of public health. So let me now proceed with a few slides. I won't take so much time, but I will focus on a few key messages. As an outline, just to take you through with what I'll be talking about, is where is India in the pandemic, the vaccination drive, what did it entail to get to this point of 53 million people vaccinated, and future possibilities, because that's where the theme should speak to. It's been a long year, over a year of, and it feels like decades, really. Every month feels like a year because of all the lockdowns and all the restrictions we have to have, and all the compliance we have to have. But there are really future opportunities which COVID-19 response has taught us. Where are we? It's just a big summary of the curve. So there was a peak sometime in September 20, I remember the date, in fact, might be September 2021, of the cases in 2020. Then really a consistent decline. But recently we've been experiencing a bit of an upsurge. There are few states that contribute as much as 60% to this upsurge, but there is a trend of increase. The deaths are also decreasing. It's always been low, and that's the miracle of how India has been managing the pandemic. It's not a miracle, but it's like early detection, early testing, early hospitalization if need be. So just to put us into perspective, that yes, there is an increase, but what I always say is that let's focus on what we knew how to do to bring down the cases. And this time we have a special tool in our arsenal of the vaccine. So I'm very hopeful for what this will provide. I will not try and explain every little thing. We all know we live in India. I've been in India for 16 years. It is a huge country with various diversity, but this is the picture in which probably we are closest at, and that would be true for each state, different intensities. And what's important to know is that we know the actions. A bit of the factors for the increase. Contact tracing has been inconsistent in a few districts. Testing had become variable. The testing rates in some districts remain to have low testing rates, especially with the RT-PCR. And of course, us as the population, the public, where our appropriate behaviors have had some gaps, and we have the non-compliance in public places, markets, shopping complexes, mass gatherings. So, and as we know, culture is very intertwined in how we live, especially in countries like India, where the wedding must happen, Diwali must happen, Holi must happen, but there's a safe way to do this. And if there are gaps because there is complacency, but also because there is the hope of the vaccine, I guess then the recent increase in cases is a reminder to address all the basic public health measures that have been done already well and reinforce those. Well, states and districts have had strong response, especially those with a very big upsurge in cases, containment zones, enforcement of wearing of masks, restrictions on social gatherings, closure of schools, some night curfews, 24-hour vaccination sites, and some have a limited lockdown. So what I'm saying is that despite the increase, many of the states, of course, all the states actually know what to do. What is interesting and important to note is that there is sustained lab testing. If you recall where we were last year, the cases peaked as well because the capacity to test was not up to the mark for a population of 1.2 billion. But the rise in the capacity to test was in that point of one lab in Feb 2020 to 2,397 labs, of which 49% were private. So this is now the availability of testing. So if you are symptomatic, you're feeling symptomatic, you can proceed and get your test, and it's done within a few hours, 8 hours, 24 hours, you get a result. The test positivity rate went to as low as 2.3% even 1 to 2 months back, but now we're back to 4.4. But the point is the time now for us to really come together and bring all those response elements back. It's phenomenal, the number of tests. It's 237,503,882 as of March 2024. That's as close to the population of all of Europe, if I'm not mistaken. And as of March 24, we're back to the daily a million a day tests. So this is phenomenal, and it's a discipline that has not left as it was set up as the pandemic response was ongoing. There's a declining case fatality rate. The numbers speak for themselves, as I've presented. To this day, around 61% of districts have not reported a COVID death in the past 21 days. That's 3 weeks. So that's also an achievement. So there are these big elements of capacities that will be able to address this recent surge of cases, as was done in the past 6 months. So what is our role? Maybe you're wondering, what does WHO do in all of this? We have a huge support role, and I will not be timid about saying about that. Our main role is to support the Ministry of Health and Family Welfare and relevant ministries in the COVID-19 response. There's a UN joint response plan around this. The health parts are led by WHO, and other agencies are also supporting. It's based on national plans and strategies. It's not parallel. And the goal is to really slow down transmission, reduce mortality associated with COVID-19. There are several elements of this plan, several pillars, which include surveillance and rapid response teams, RRTs we call them, for case investigation and contact tracing. We've come to a point that many states even did house-to-house contact tracing, house-to-house surveillance for active case finding. UP has done that. Gujarat has done that. Points of entry, early in the day, all points of entries had screening areas, screenning facilities, and a proper referral system, training for those teams. We had supported national laboratories, the scale up, the initial problems in supplies for RT-PCR kits, we were able to support. Infection prevention and control guidelines, and finding really where we can train health facilities to better improve infection prevention and control. Case management, this was an evolving thing. There is a regular meeting with at central level in terms of the joint monitoring group of all clinicians coming together. What is the new evidence and what would be the decision? Providing that evidence, sharing all that knowledge at the global level was also one big part of our role. Facilitating emergency procurement, that I've mentioned in the RT-PCR kits. At some point, we were able to support even PPEs, etc. But mainly our other UN agencies were also who are better at logistics were managing this. Research, innovation, and knowledge sharing. This is huge. You might have heard of the Solidarity trials, the Unity trials. We have partnered with premier institutions of the country to run a lot of studies around this and support them, whether it's methods or training around the methodology and running surveys, etc. Country level coordination and planning and monitoring. So we do have also teams in the states for which we are able to guide support to the different state health authorities. And lastly, I put that in a circle, it's protecting health system and services. It's one pillar, but it's actually a huge pillar in which we have invested time so that safe deliveries continue, immunization continues, delivery of essential medicines for diseases such as TB, hypertension, even for neglected tropical diseases where you have to have schedules for mass drug administration. Now I'll move to the COVID-19 vaccination in India. In that epi curve, in that epi situation I gave you in terms of cases, vulnerabilities, and outcomes and trends, the game changer is this, that there is a vaccine in India and a vaccination going on. Vaccines don't save lives, but vaccination does. So I will briefly summarize to you what it entails. So it's a multi-level governance mechanism, multi-level coordination mechanism. For a country as huge as India, where it's we have to be able to reach 37 states and union territories, as well as 770 districts, if I'm not mistaken. You need to have a coordination mechanism. So we have the NEGVAC. I'm sure all of you have heard about this, but at state, district, and block level, we have parallel structures of how this was to be led and rolled out. The state steering committees, the district task forces, the block task forces, each of which have their own control rooms dedicated also to vaccination itself. So the overall policymaking body, the umbrella body is the NEGVAC, and then intersectoral convergence, preparedness, implementation, monitoring, local adaptation, because there's so many contexts once you get down to state, and it's more so when you get down to district level. That is where the rubber hits the road, as so they say. And so that's where it will be a game changer in terms of success of implementation. What is our role? A lot of it was a support to the development of technical materials, the COVID-19 vaccines, operational guidelines available in public through the Ministry of Health and Family Welfare website. Well, it has several areas from prevention and vaccines, multi-level governance mechanisms, which I just talked about. How do you coordinate per sector? What is the role of every sector? Who coordinates who? Human resources training, capacity building, where we are really very much a part of, and showing you some materials that were developed. The digital platform, this will not run without a digital information platform that is real time. I'll also talk about that in a while. Training health workers how to administer the COVID vaccine, the adverse events, how do you manage them, but also how do you record them and how do you investigate them? monitoring and supervision on a daily basis, vaccine logistics and cold chain management, and of course, communication and social mobilization. That's what it entails to set up and run a vaccination campaign for a new vaccine. It's summarized in one slide or 144-page operational guideline, but I can tell you that it's worked for 3 months, no weekends, 24/7. The ministry is on it. There is non-stop meetings, non-stop coordination calls, it's non-stop. The operational guidelines were also changing as we knew more about the vaccine. So you plan for what you know and you keep dynamic and have a space for what is still to be known. At that time, none of the vaccines yet were listed for emergency use by the country, regulatory authorities, or by WHO in its emergency use listing. But what was known is what was to be planned for. For example, it has a cold chain that needs to just be surged. So the vaccine that will be used will, of course, not be a ultra cold chain vaccine, which is a different investment altogether. It leveraged on what it has. This is a vaccine for adults, mainly older people. So leverage on lessons of measles and rubella campaigns. It's happening at the digital age of social media. So leverage what we know about social media, communication for risk communication and the public, and learn from that and improve on that. As in the digital age, you cannot do without an information platform. So as mentioned, the approval for the vaccines for restricted use in emergency situation by the Drug Controller General of India was on 3rd January. It's, of course, as you all know, Covishield and Covaxin, which are very similar in terms of its operationalization. 2 intramuscular injections, storage at 2 to 8 degrees, existing in the country, only to be ramped up further. And it's used for stopping the pandemic. With the phase 1 target populations, here again, the lens of equity that you were all talking about, the most vulnerable to the infection, healthcare workers, frontline workers, 45 years old citizens with comorbidities, and 60 years old and above with or without comorbidities. This is the phase 1 target population. And as you know, this is all moving so fast. As of last night, it's 53 million citizens have taken at least their first dose. So this is the COWIN. It's a vaccine delivery management microplanning tool, IT-based, real-time, live. And it also was built upon existing tools such as the eWIN for routine immunization and the SafeVac for reporting adverse events following immunization. It is end-to-end from the time the manufacturer releases the vaccines or its orders to the point of storage, to the point of the primary healthcare center, which will be the vaccination center, and for beneficiary registration. So you plan your session, beneficiary vaccination, acknowledgement, providing you a unique QR code based on your certificate for completion of a dose, and if at all an adverse event following immunization, also tracked in the same information platform. So this is just so important. That's why you see these dashboards live on a daily basis, update itself. Of course, we had some roles, as mentioned already, our technical support. WHO has a long history of support for immunization programs, including eradication of polio in 2014, certified in 2014. And that's where we're leveraging the skill set and the infrastructure that we have and the teams we have in the field. Cascaded the training programs here I am very thankful that we are into virtual learning. That was the only way this would have gone fast. Several sessions happening every day at different levels. Preparation of micro plans, preparedness assessments of states, district planning units, vaccination sessions, supporting dry runs, and now also monitoring of session sites daily with real-time reporting. That's what some of our teams in the field are doing, and facilitation of task force meetings, and regular feedback at all levels, and support for communications. As such, there have been over 13 million healthcare workers vaccinated, 11 million frontline workers, 45 to 59-year-olds, around 5 million, and you have more than 23 million above 60 years vaccinated. 91% are being vaccinated with Covishield and 9% with Covaxin, and this is just because of supply issues. Summary of the COVID efforts. This is one slide to summarize the story of the response and the vaccination in India as a response to COVID-19. The presence of one lab in February, one PCR, RT-PCR gold standard lab now, which was also doing tests for other countries at that point, to, as mentioned, 2,300 plus labs by August, and to present it's still increasing. Development of new technologies, rapid antigen tests, treating 175,470 facilities remained available for non-COVID cases and services, so that continues to be served even at the peak of the pandemic. Over 25 million contacts traced. That's almost another country altogether, and that number is rising. I can keep continuing giving you numbers of how this coordinated effort has provided a model for the world, if I would say, and as mentioned, how the vaccine rollout went. This is one of my last slides. I will just focus on this because it's about what healthcare revolution can be. I always say that the COVID-19 pandemic can give us a space to reimagine things. It's not even to build back better. You always hear that word after an emergency. I used to, since the tsunami period. But to build back differently. It's about a rethink. And I think you as students of IIT Roorkee have that space to reimagine the future. It's not only for institutions right now, but to involve all of sectors, especially the youth, to rethink this. What is a resilient health system? How well will our health personnel be trained for emergencies, prevention, response, recovery? Will our hospitals withstand? How will we redesign hospitals that will be newly built for another possible pandemic, but also to look at regular disasters that happen. Our hospitals, let's say in Assam, flood resilient, or even in Delhi, earthquake resilient. It's really looking at this now, at all possible shocks that can hit a health system, but to survive it, because it should not collapse at the time when it's needed the most, whether it's people who run it and provide healthcare or the facility itself. Now, if this health system was resilient, other systems should be too. Supply chains should not break down. And this is what's the interesting thing in terms of the response in India. It's whole of government, whole of sector, where you have an increase also of all manufacturing capacity for PPEs. The manufacturing capacity for vaccines were leveraged. So how will you be able to deliver such supplies? It should not break down. India is the pharmacy of the world, that we know. 70% of the world's vaccines for most of the antigens that are required for routine immunization are coming from India. And that technology, that know-how, that capacity to manufacture was also leveraged. And I think this is also the future for which India's evolution will contribute to the world's change in healthcare. Medicine should not be as prohibitive. The principle of universal health coverage is that no one will become poor because of a health issue or a disease. That should not happen in this day and age. Digital health, this is the future again, and it's the now. I'm not even saying the future. You just heard what I talked about in terms of COWIN developed for the vaccination alone from September to the time of its launch. eSanjeevani, telehealth clinics. Telehealth will be a wave of the future, a way to triage, but it has to have standards. What would these be? What would be the new technologies that can also facilitate and not hamper doctor-patient relationship, like a good history? I got, as a learning platform, remote consultations. I'll talk to you about a bit the Integrated Health Information Portal, where we are at the point where all types of surveillance for different diseases will be available in one integrated health information portal. It will include a module on health management information systems, surveillance for diseases of epidemic potential, the TB's NICSHE surveillance system, all together in one platform. So you're also able to interrelate and not look at health as vertical programs of disease control and prevention. India is a driver for global research and innovation that we have seen in this pandemic. If it can happen for that short period of time, why not as a regular program? Addressing other determinants of health. Jal Jeevan Mission, as you know, also has health goals. The Urban Mission 2.0, Swachh Bharat Mission will all contribute to health. How do we further leverage that? And I think India is so well placed. The Ayushman Bharat has provided this opportunity to be a social net for health expenditures as a health insurance, but also as an investment for comprehensive primary healthcare, where you have health and wellness centers. As of 2 weeks ago, it was 60,000, and the goal is 150,000. So it's really close into getting services out there for health. And I would just say collateral benefits for public health goals. I don't know to call it by COVID, collateral benefits of the response, I guess is a better way to put it, of ending communicable diseases. TB, Kala Azar are all ending them are all doable goals. If more and more of these innovations contribute to a stronger health system for India. I will take some time just to ask you how you can support further COVID vaccination. With increasing cases, it's also better to now advocate for vaccination, especially of family members, loved ones who are in that age bracket and this priority population. Please amplify positive messages on COVID vaccination in social media. There are materials that you can use from ministry, all developed with support from UNICEF, partners, ourselves. Assist in registration of populations with limited internet access. Maybe someone just needs help in terms of connectivity. Support vaccination of high-risk groups that I've mentioned. Volunteer with district block authorities to help in mobilization of beneficiaries. The government of India encourages development of applications for registration of beneficiaries having API with COWIN application. Maybe that's another future. You develop your own app to support efficiency of COWIN. Brainstorming technological interventions to support COVID vaccination activities. There will be many ideas, I'm sure, from all of you. Most of you are in the field of IT, and finding the applications for IT for environmental health or healthcare evolution, revolution, as we've mentioned, is key. This is my last slide. It's a thank you to all of you that if you could help us with delivering this message of the 3 W's. Call it 3 and you flip it, it's W. Wear a mask, wash your hands, and watch your distance. Even if you're playing holy, please, you can play it safe. Play it at home. Don't gather as a crowd and play. That would be safer. Wear a mask. I will end that it's all about a message of equity. So on Universal Health Coverage Day, we put up a mask with Sabka Swast, Sabki Suraksha. So it's health for all. Protect everyone. It's protecting everyone from COVID, protecting everyone from any health problem. So leveraging these opportunities, these lessons, these good practices that can really redound to a huge health impact sooner than later for India is where you can all join hands and contribute. So not for yourself, but for the nation. Thank you very much. I have to show my mask.
Thank you so much, Dr. Offren, for sharing your opinions and knowledge with us. It was indeed very insightful for us as budding evolving youth to listen to you. The next guest of our evening today is Dr. Raman Ganga Khedkar, who is the former Deputy Director of ICMR, Indian Council of Medical Research. In his 2-year period with ICMR, he had actively handled the Nipah virus outbreak and the 2020 coronavirus pandemic. Additionally, he had been awarded the Padma Shri, the 4th highest civilian award in India, for his service and research in HIV/AIDS. He has also served as the director in charge of the National AIDS Research Institute and the head of Epidemiology and Communicable Diseases Wing of the Indian Council of Medical Research. We humbly welcome you, Dr. Ganga Khedkar. Over to you.
Let me, in the first place, thank the organizers, Dr. Chaturvedi, who is your director, Dr. Gulati. I especially thank Harkirat and also Dr. Rodrigo to have had given some description of what is happening as of now. To be really honest, I was humbled. Initially, I didn't see the attachments that you had sent, what NSS does at IIT Roorkee. And then when I went through that, I did that only half an hour back. But when I went through that, I realized, there was something which I used to wonder. When you hear different social entrepreneurs who are coming with engineering background, that used to be a puzzle for me, because social entrepreneurship, and I thought engineering, how does it come together? But when I read the entire thing, when I saw how you people are working on public health priorities, whether it is issue of education, science education to people, whether it is an issue that is related to road traffic injuries, whether it is the subsequent major danger that the entire world is going to face once COVID will perhaps get over, and that is antimicrobial resistance. I was completely taken aback, and I must say I am humbled to be talking on a different issue with you together. I'm not going to use any slide. No, what I'm going to do is I'm going to use this opportunity to relive how things unfolded. What did we learn during those 6 to 8 months time when things were happening at a dramatic pace in India? One of the things which we have to realize is, we didn't realize that the new year that will come will perhaps present the world a unique challenge with which we would be struggling. It was a kind of an ugly shock. It was a kind of an ugly reality to which we were going to present ourselves right on 1st of January, because 31st was the date when the first publication occurred that there is a small case series that has actually taken place somewhere in China, in Wuhan. And then I recall on 11th of January, Dr. Rodrigo's predecessor, Dr. Henk, he actually called a meeting, where it was a small gathering, about 8-10 people. We were sitting together. He just informed that this is what has been seen in China. None of us at that point in time felt that we are actually hearing, that the pandemic is likely to evolve out of that situation. This is a reality. No. And then one thing which we have to realize, that we had to grapple with one reality, that we did not have a strong surveillance to detect such kind of infections that could occur. No, earlier, as she mentioned, no, we tried to fight with Nipah very strongly. We tried to establish a network of in Southeast Asia region with 10 countries. But the reality was, each time a new infectious disease used to come, Zika came, I lost my track. Where after that, COVID came, and with COVID, we lost that complete track, that we were to establish a strong healthcare system, especially the surveillance. But we had established a good surveillance in Kerala, because fortunately, Nipah had occurred in Kerala. So we knew that at least there we were pretty strong. And the surprise, as usual, has to come. One of the biggest surprises to my mind, I have worked extensively in the government for HIV programming, TB programming, the hepatitis programming, many such smaller programs in addition to that. But I have never seen a very coordinated action that was taken on just a small report that was actually read and deliberated upon. On 17th Jan, the entire government went into a very strong exercise. That was something which was amazing to see. And from there on, every day there used to be a meeting which was chaired by one of the most senior bureaucrat in this particular, in our country. Now, when that was happening, one of the things which was realized is, we need to be vigilant. Though we did not have a strong surveillance system to detect it, now how would you keep that vigilance? The vigilance was, you needed to test. You needed to test people. Now, if you were to offer the test, there was only one ICMR institute, that is ICMR National Institute of Virology. Though we had 26 institutes, we had to only rely on ICMR NIV to try and first standardize the test. No, once we standardized it, I think, somewhere around 21st of January. And then we started rolling out. Initially, the samples used to be 2 or 4 samples of suspected cases coming from different parts of the country. And then we used to get them tested. By 27th, we were only testing 4 to 6 samples in a day. And you could imagine that suddenly we came across the first case report that occurred in Kerala, where a medical student coming from Wuhan was found to be positive, and there was another friend of her who was also studying in Wuhan. He was also subsequently found as positive, because they came back from Wuhan to India at that juncture. How did we keep some kind of a vigilance then? We started looking at, discouraging people to visit India from countries where it was occurring. No, second issue that we tried to do was try and ensure that all those international travelers are actually screened to some extent to actually identify whether they could be potentially infected. But the major problem that was there was, we had only one lab. There was another lab in Kerala which actually belonged to National Institute of Virology as one of the state units. Now, these two labs were able to undertake testing, which could be close to about 100 to 200 tests that could be done every day. But the issue was, how do we offer testing across? Because a disease where it is only non-pharmacological intervention, isolation, test them, isolate them, was the biggest strategy available at that juncture. How do you do that? Now, unless you test them, you will never be able to know that. Now, one of the biggest tasks that we had was to try and ensure that the access to treatment goes up. And how was it done? It was done through, first through 35 virus research diagnostics lab out of 106 which we had in India. What we did initially was these 35 labs were already doing RT-PCR in influenza network. So we started taking them in, and then using the entire resource, every day new labs were being trained virtually. No, that's something which was unimaginable, because one of the fears that you had at that particular situation was whether some people, if they are not adequately trained, would acquire this infection just while testing them. No, whether they will follow standardized protocol. So you had to start with quality assurance and quality control programming even for them. No, so essentially it was a huge task. One entire group of people used to sit in a room and conduct these training activities throughout until about 4 months time or so, as I remember. And the result is very much evident today. If you look at it, we have created an infrastructure which could offer molecular testing even up to district level, where you have now established the whole testing system in almost every part of the country. That's something which was amazing that has happened, which we need to sustain, which perhaps gives you a confidence that our systems can be scaled up in terms of technology. But we need to have a vision, we need to struggle to ensure that that happens. And the struggle was not so easy, because initially we got support from WHO. We got about 10 lakh odd tests, reagents from WHO. But when you want to offer the test to people where the population size is 135 crore, we couldn't think of anything. How do we buy these reagents? And when we started purchasing them, the entire world was chasing these reagents, because everybody, including USA, was also struggling to get the reagents. And one of the important issues that we have to understand, most of the reagents, either they were coming from China or they were coming from South Korea. And the result was, people used to say that we will provide the test reagents, but they used to take inordinate time. It's not only a question of reagents. No, we didn't have N95 masks. We didn't have personal protective equipment which were getting manufactured in India. We did not have a capacity to provide oxygen to so many people. So we had to divert industrial oxygen to provide it for care of people, and ask those people to create more oxygens so that we can actually offer people to do something. So there were insurmountable issues if you look at it today, if you reflect it that way. But we did extremely well because of the support that came not only from the policymakers but also from the industry. No, to operate at a time when the lockdown is there, no, at a time when mobility is restricted, was a very difficult challenge. To even provide diagnostic reagents to different parts of the country to sustain testing, we had to use, because the planes were also stopped after some time. You suddenly started realizing, how do I deliver my reagents to a X laboratory which could be in Manipur? No, how does it go there? So we had to even use all cargo planes that were flying, carrying essential stuff, as well as even from the armed forces. We had to actually use them to try and deliver that. So there are challenges that come, but India is a very resilient country. India can do it if it comes to our own mind and do these activities. We had to provide even the equipment. So training could only be followed after provision of equipment, and equipment were also short in supply across the world. There was not a single place where we could easily put up the orders. So we had to request the industry, produce more ventilators, produce your RT-PCR machines, you produce even swabs, because swabs used to be even imported at that particular point in time. When it came to medicines, medicines was still a worse issue, because for medicines, most of the supplies, especially the most critical ones, the key starting material and the active pharmaceutical ingredients were coming actually from China. No, and rest of the places it used to be very costly and they had limited production capability. So we had to actually ask the industry to try and ramp up. We identified different drugs which are most critical, which are dependent on supplies of API from China. And then we asked the industry to try and produce these drugs, produce APIs, produce key starting material. Production of key starting material is not so easy, but we were successful. There were no drug shortages. Otherwise, if drug shortages would have had occurred, it would have had been a worst case thing. Now, what was one of the most important tasks when the lockdown started? One of the things which we had to realize that if it is non-pharmacological interventions, which we now call as COVID appropriate behavior, which we have to promote within the population, one of the fears that I had, at least at that juncture, I wouldn't say much about others because I can reflect on what I felt at that point in time and how our suggestions were. One of the fears that I had was how do we educate close to 135 crore people on COVID appropriate behavior and ensure that they are followed up. No, it's a humongous task. No, if you were to go for any health education in a short period of time, perhaps it's impossible in India because there are people who would agree to anything that you say, disagree. A large proportion could be there that could also be in disagreement with you. So one of the issues was lockdown and engage people through press on how they will have to behave, how they will understand different issues. And lockdown was the only alternative that was available there because we wanted to restrict the numbers. And what is also important that use the 4 or 5 months time that we got to prepare our healthcare infrastructure in such a manner that we will be in a position to handle that. So one of the issues that needs to perhaps emerge is we got a strong support from the community during lockdown, but there are competing risks and benefits that the community also perceives. When community tends to think about health through measures which are like lockdown, which is about fear about an unknown organism, you suddenly find that it becomes a fear driven message. Now if it is a fear driven message, even if initially people adopt these behaviors, no, sustaining those behaviors actually becomes an extremely challenging task because fear can always wane away the moment the numbers start coming down. So essentially, what was it that was happening? No, in addition to that, the All India Institute of Medical Sciences, Dr. Guleria, took a took a huge exercise to train people in managing these patients in intensive care units. It was not an easy task because you have to understand you can procure ventilators, you can provide those ventilators, but people should be trained to use them. Otherwise, it's an extremely difficult task. And he did it. This entire exercise was done by AIMS through telemedicine, even trying to tell them how things have to be done. And then there used to be a huge exercise in terms of producing guidelines for diagnosis, producing guidelines for management, producing researchable areas, priorities, and try and attack this particular problem as much as possible. So essentially the impact was as much seen by all of you. Now we realized that with these measures, with the support of the community, we could bring down the first wave. One of the most important issue, delaying the onset of this outbreak by 4 to 5 months, gave us an opportunity to treat patients based on other countries' experiences. Now, initially, if you remember, now in Italy, what was happening? People were put on ventilator right away, and most of the mortality was associated with ventilators itself. No use of ventilator or its complications itself. We started realizing that it's oxygen, high nasal flow oxygen, it's the other supportive care which becomes important. It's prone positioning, that becomes very important. No, those steroids becoming important in management. We did not rely on newer drugs which were experimental, and we did not have to, because our onset of outbreak was late. And the reflection is very clear. We had lower mortality rates. Our numbers did not rise because of the support of the population. No, did not rise as much as people could have had imagined given the population size that we have. But we have to also realize that when it comes to the impact, for the first time we could strongly see impact of health outcomes on and the association that it has on economy as such. What we saw was the association with livelihood suddenly becomes important. If you actually recall that when we tried different ways to handle this outbreak, you heard about messages, that you heard about the news that in Dharavi they became successful in controlling this infection despite the fact that it had very high population density. The reason why they could do it was they were even providing measures which could sustain the family. When the family was isolated in the households, the NGOs used to come together, provide food to them. Whatever they required was also provided by them. The result, they suddenly became normal very quickly. Unfortunately, today, what you are finding, a second wave is emerging. No, the reasons are very simple. These competing risks and benefits of staying alone, not going out, or COVID appropriate behavior. You have earning livelihood as a burning issue. People tend to give up COVID appropriate behavior very rapidly because they feel that the decline in infection does necessarily not require these COVID appropriate behaviors adherence. But that is absolutely wrong. No, we have to learn a lesson that when you actually reach towards a declining phase, if you want to go towards elimination, we need to ensure that we actually intensify our efforts to prevent that infection rather than slowing down and giving away all those necessary measures quickly. That's something which we must try and avoid at all costs. But unfortunately, that did not happen. The second issue, which is also important for us to understand, people were hearing different kinds of stories, where some of the stories tended to say that now India has been successful in controlling this outbreak. But the success that was being claimed was premature, and the impact was as much visible because people start feeling that now I don't need to follow this COVID appropriate behavior. The second thing, which is also important for all of us to understand, we used community opinion leaders model. Now, one of the models which can be used for community mobilization, community involvement. But when we use that, we also need to realize that when you use the opinion leaders in the period like lockdown, no, they have huge sphere of influence. But as the lockdown wanes off, the sphere of influence also wanes off, because your sphere of influence, let's say if it was a district collector telling that you must use this COVID appropriate behavior to defend yourself, when that was occurring at the lockdown time, perhaps I can give a crude example. 1,000 odd people listen to it. The numbers could be, true numbers could be very large, but 1,000 odd people were listening to it. But as the lockdown goes down, no, when the same person tends to give you similar advice, you find it's not only gets down to a number which could be around 100, which could be around 50, because now they start listening to voices other than those to which they would give importance to earlier. So that lesson has also got to be learned at this juncture when it comes to the second wave that we are going to handle. Now the issue is vaccination. No, we had, to be honest, we had about 3 months time where we could have had rolled out the vaccine very strongly. We could have had done it in a different manner. Instead of relying only on global approach, of how to do it, perhaps things could have had been different. But at the same time, we must realize that when you talk of unknown fear of an unknown, not so well known disease agent in the lay population, when it comes to vaccination, we did not realize one thing, that this is adult vaccination and adults are not used to taking vaccine. No, when you think in terms of how is adult behavior, no, when it comes to providing vaccines to children, their own children, they will never think of side effects. They will assume that it is highly efficacious. But when it comes to taking it by yourself, suddenly too many questions are asked. Why does that happen? That happens because they are not used to taking vaccines in adult life, and the result was very much there, that vaccine hesitancy challenged us dramatically in first 2 months time. And when that vaccine hesitancy was seen, no, we where we could have had provided protected a larger proportion of the population, that ability was reduced to a larger extent, and the result is we are at present struggling to move ahead, because you have a strong second wave that is surging up, and at the same time you would have another demand of vaccine to be provided rapidly, a rollout to happen very rapidly. Now that's something which is going to be a major challenge for all of us. Now if you actually look at what happens with the vaccine, you find people were worried about side effects, but then at the same time from global sources, different pieces of information started coming up, not only from news but also from the social media, which raised controversies one after another. The result is we don't realize that it impacts on vaccine hesitancy. People then suddenly start suspecting either efficacy or the side effect profile that a vaccine could have, which perhaps needs to be negotiated through such action groups like you have, the NSS action group, which can actually go in the community, talk to people that this is not a true story. No, that you don't need to rely on social media where a single case is generally reported and we do not know the denominator. No, the number of people who have successfully received it or they did not have any kind of side effect. But that needs to be taken up in a stronger way through associations, through the professional, through the national service scheme like you have. Now, where would we go in terms of this second wave? Now, this, as I must tell you with a disclaimer, that these are my individual views, neither of ICMR. Now, I have retired in the month of June. I could only say one thing: the numbers are going to rise dramatically. What is most important is when the numbers rise, people today are saying that number of deaths that are occurring are lesser, but the reality is you will know about the true number of deaths, absolute number of deaths, only 2 weeks after the incidents that you have recorded. So you would have a delay of 2 weeks time. What is most important for us? We have most important tools at our hand. One is vaccine. The vaccine is going to reduce the risk of death by almost 100% among the vulnerable population. That is those who are older, those who have chronic morbidities. When it comes to reducing transmissions, the vaccine tends to lose efficacy when it comes to reducing transmission. So essentially what might happen, if we go for a rapid rollout, rapid community, rapid acceptance by the community to take these vaccines in larger number, you might find that the absolute number of death for which we are scared of, those numbers will be far lesser. Perhaps the reduction of transmission may not be reflected as much in terms these numbers could still keep on rising, but that may not pose so much of challenge compared to death and the stress that would occur on healthcare infrastructure. What is most important for us to understand? People are worried, newer variants are coming. Unfortunately, in COVID, what has happened is every scientific debate is occurring in the media. Now, earlier, if there was a occurrence of a variant in the field of HIV from where I come, no, people did not know, even the doctors who did not belong to that discipline, would not have had known what exactly is happening elsewhere. Neither would they be too interested in knowing about it. But unfortunately, now with the panic that has set in, any news, any new paper that is published, people tend to draw conclusions as they understand, and the result is people actually behave in a manner which is inconsistent, mainly because I am going to draw that conclusion, I will decide what I have to do. What is most important that we have to communicate to our own people? One thing which we must remember, that vaccine protects you from death. What is most important, if the variance is an issue, then you must remember that whether it is variant, whether it is wild type virus, it is, if you go for COVID appropriate behavior, if you adhere to COVID appropriate behavior strongly, you are almost ensuring that you will not get infection. So you don't need to worry too much if you are going to go for a COVID appropriate behavior in a strong way. What is most important for us? People tend to feel, if I take vaccine, perhaps I don't need to worry about COVID appropriate behavior because I am now protected. But you are protected only against the likelihood of death if you belong to that vulnerable age group. But this doesn't protect as much against acquiring infection if you are exposed. So essentially, the messages that we need to disseminate in the people, try to tell them in simpler language, are essentially revolving around, please adhere to COVID appropriate behavior irrespective of your vaccine status. When would this situation change? Unless the entire world reports that the infection is no longer occurring, perhaps we cannot be complacent and say that we are perhaps not going to see this infection coming up again. What is most important? Why am I saying the entire world and not India? One lesson that these new organisms, the emerging and re-emerging organisms, have taught us, the most important lesson is these organisms do not respect geographic boundaries. Today's world is one with so high a mobility, so much of migration tends to take place. You will find that if the other countries are not secure, perhaps your own country would also be as much insecure, because any day that infection can come. India has adopted a very strong strategy related to Vasudhaiva Kutumbakam. The vaccines that we are manufacturing, we are also donating simultaneously to different countries. And the reason is very much clear, that if those countries are safe, we are also safe. We cannot remain safe by ourselves. But the message that we need to pass additionally is, if you want to remain safe, if you respect your own life, if you respect your quality of life that may perhaps change with post-COVID life that tends to follow if you are careless, perhaps you must remember that you have also got to ensure that your responsibilities that you have for the family, your responsibility for the community, no, you need to ensure that you follow COVID appropriate behavior. You take vaccines, you take interventions that come to you. COVID appropriate behaviors are not very difficult to follow. They're not very costly interventions by any means. They're not going to affect your ability to discharge your work or duties at one given point in time, wherever you are going to go and do whatever. But what is most important is, we need to recognize the multifold value of COVID appropriate behavior. If I use masks repeatedly, no, I can even reduce the number of incidences of respiratory infections that could occur to me. If I use my hand washing technique, I might reduce the diarrheal diseases load or burden of disease that tends to exist in the country. We need to remember that they appear as very simple measures, but they are most effective. You go to the Far East, no, what do you see? In the Far East, even in pre-COVID era, anybody, no, you walk, you go in Japan, you go in South Korea, you go even to Thailand, no, you will realize that if somebody is sick, no, he will wear a mask and then walk out. No, because he doesn't want to transmit it to others. Now that's something which is a classical example. But what we have shown so far, we change, we changed when SARS came, we changed when we heard about MERS, but we have also shown one lesson for everybody to think about, that our memories tend to do not last longer. We forget about all those lessons, which has not only happened for SARS and MERS, which had similar COVID appropriate behaviors to be followed, but also in the case of COVID, when it was not gone, when it was still occurring, we forgot because we thought that I want to be free in quotes, but we are inviting our own problems, and that's something which should be avoided in future. What is important is every individual should believe that your health is not government's responsibility. Your health is first your own responsibility. Your family is your own responsibility. But when you say your family is responsible, be an opinion leader for your own family members, follow COVID appropriate behavior. And what is most important is your sphere of influence as an individual is also large enough. You have so many friends, you have so many people whom you meet. Those who are not following this behavior, please try to advocate with them. Please try to plead the case. Ensure that everybody does it. If we do it together, I'm sure with the science, the way it has been progressing, with the science coming up with newer tools to handle this outbreak, within such a dramatically short period of time, no, within 13 months, we have made so much of difference. No, if we can do it together, along with the scientists, along with involvement of everybody, and the government is always there to support you. Government has its own role. Trust the government. Don't suspect the government on everything. Are they providing inferior quality of whatever? No, no government wants to damage its own population. Please trust them. Please get yourselves involved in the fight. This is a pandemic. This is not yet over. All together we can do it. And I'm sure people like Harkirat, people like IIT Roorkee, the NSS scheme, if they decide to make a difference, perhaps today is a time when you have to think of initiatives which would have multiplier value. No, if you could come up with activities whereby you could influence human beings, different human beings, whom you could talk, you could tell them that please participate in promoting the health, the healthy behaviors, especially COVID appropriate behavior, even if you can reduce the infections, let's say in thousands by your own activity, no, we would make a difference together. And I hope to see a new normal coming up earlier. But the reality is the challenge is too tough. We don't expect new normal to come. We would ensure that our own behaviors could be our enemies. But I'm sure looking at the brochure, looking at your activity profile, and looking at the skills in social engineering that you have, perhaps you would do certain experiments which could augment our capacity to fight this infection. Thank you.
Thank you so much, Dr. Ganga Khetkar, for helping our fellow audience with one of the most essential matters going on in the country. It was indeed very enlightening to hear from you all this while. Now, we will be moving forward to our next guest for the evening, Dr. Randeep Guleria, who is the current director of the All India Institute of Medical Sciences, AIMS. He is credited for establishing India's first center for pulmonary medicines and sleep disorders at AIMS. Being the author of the national bestseller, Till We Win, he has shared his invaluable knowledge about the current COVID-19 pandemic and provided the audiences with data driven by science and reason. He has also been awarded the Padma Shri, the fourth highest civilian award in the country. We are grateful to have you with us, sir. Dr. Guleria, over to you.
Thank you, Kavya. And I'd like to start by really thanking IIT Roorkee for inviting me and congratulating everyone for this National Social Summit 2021, which is being done by the National Service Scheme
of IIT Roorkee. It's really a great event with so many luminaries there, and I'm sorry that I joined in late, but I had a prior appointment. Um, Let me first say that the summit itself is looking at uh, envisioning better healthcare evolution and lessons from COVID. That itself is something which is very, very important, because as we move forward, we must not forget the lessons that we've learned in the past and see how we can really build on that. COVID has had a huge impact as far as healthcare is concerned. It has really put healthcare on the center stage. And because it has had an effect on healthcare, it has also shown how healthcare is important when it comes to all other parts of our society, whether it be the economy, whether it be social interaction, whether it be a lot of things that we take for granted, and whether it be livelihood. All of that gets affected if we are not looking at health in a holistic manner. And I think that is something that we have not done as a nation for a long time, and COVID has really sort of woken us up for that. We've there's been a lot of discussion on how we uh, sort of been through as far as this pandemic is concerned. When we started about a year ago with the first lockdown, there was almost a panic among healthcare workers as to what we will do in a situation where we would have this huge number of cases. We are seeing reports from what was happening in Spain, in Italy, huge increase in the number of cases. And when we compared that with the size of our population, the type of healthcare infrastructure that we had, we were all frightened that we are going to have a huge challenge on our hands. But I think we all came together, and it showed the resilience of our country, that we realized that we really need to work in a manner that we can overcome this challenge. We started off with very few labs which were doing testing for COVID-19, and that was mainly based on the network which is already there for flu testing, which was the another virus which is there. But rapidly we were able to expand our labs from less than 10 to 15 labs in the country to more than 2,220 labs now, and with the capacity to test now a huge number of people as far as COVID-19 is concerned. A lot of the kits were being imported, but a lot of our scientists came together and started making kits locally, whether it be the kits, whether it be the viral transport media, whether it be simple things like a nasal swab, which has to be made in a proper manner. All of this was started being made locally. We were worried about PPEs. We would run out of PPEs because all PPEs were being imported, and they were coming mainly from China. And at that point in time, there was no import happening as far as China was concerned. And therefore, there was going to be an acute shortage of PPEs. As a matter of fact, we did a research project where we started looking at, can we recycle PPEs? So if we had PPEs which were used and which were in good condition, could you clean them and then hang them in a room and use a fogging machine so that they are properly sort of sterilized, and then using various bacteria and other spores, could you really see what is the duration of this fogging required? And we were able to show that this can be done, and we can recycle PPEs. And I felt it was not a bad idea because it would also decrease our plastic consumption, which was also something that has really caused a huge problem, because we now have a lot of disposable plastics being used. And from an era where we are talking of no plastics to an era of COVID where now a huge amount of disposable plastics are being used. But as far as PPEs are concerned, a lot of manufacturers came forward, and now we are actually exporting PPEs. We are exporting N95 masks. We were running out of N95 masks. We were seeing how can we again recycle N95 masks. So I think there is a huge lesson that we've learned, and that is that we are a very resilient country. And when we're really challenged and we have our challenges, we all come together. We started making ventilators. I know various engineers came together, industry partners came together, started understanding what is a ventilator, and started making ventilators from various industries. Even car manufacturers started making ventilators using the same type of devices or tools that they had. This was something which was remarkable. And this, I think, is the biggest learning as far as I'm concerned, which is really something that should make us all feel proud, that we as a country were able to come together and overcome the challenges of this pandemic. I remember a time when people said, you would have so many cases that you will run out of beds, you will have people dying on the streets and things like that. Nothing like that happened. We were able to really manage our patients. We developed COVID centers, we developed COVID ICUs, we made COVID care centers, we worked on home isolation, we developed strategies of monitoring patients at home. We also developed strategies of seeing that we can optimize our treatment. We tried new drugs which are not being tried anywhere in the world, and were able to come out with our own treatment strategy. And that really helped us as far as fighting the pandemic was concerned. But having said that, as has already been said, that we have not really learned a lot from the lessons of the past when it comes to how the pandemic behaves and the importance of what I would say is COVID appropriate behavior. This is something that we as humans have sort of done or given up repeatedly. In 1918, when we had the Spanish flu, the influenza pandemic, where almost 50 million people died because of Spanish flu in 1918. It's said that 1/5 of the Indian population at that point in time died because of Spanish flu. India was then under British rule. Again, when the first peak happened and came down, people felt that now flu is over. We should come out and party. We should really have get-togethers to celebrate the pandemic being over. This actually led to the second wave, which also caused a huge amount of death. So if we really look back at history, we are just repeating history. Despite the fact that we are more knowledgeable, we have more drugs available now, we have vaccine, which was not there in 1980. 1980, there were even no antibiotics. Yet, we are doing the same thing that we did more than 100 years ago. And that is something that we really need to make people understand, that we should not repeat the mistakes that we've made in the past, and history is something that has taught us that. The other important thing that I wanted to touch upon is that although we focused a lot on the pandemic, we need to understand that the pandemic did have a major effect on other non-COVID diseases also, or on non-COVID programs also. For months, because of the lockdown and because of the fear of COVID, vaccine programs for children suffered. Immunization, which is a standard thing. Parents, I remember, rang me up and said, where do I get my child vaccinated? His vaccination time has come. But I cannot find any pediatrician to vaccinate him. They're all shut, and there is a delay in the vaccination. Many children did not get vaccinated on time or never got vaccinated because of the pandemic. Similarly, a major issue happened with the TB control program. Tuberculosis, we have taken the task of eliminating tuberculosis from our country by 2025. And we are working aggressively to eliminate tuberculosis, which has a huge burden of disease, not only in number of cases. Almost 9 to 10 million cases happen globally as far as TB is concerned, and we have a huge burden of tuberculosis. But the program suffered a lot because TB means diagnosis. Diagnosis means patient has to come to a center to give a sputum sample for diagnosis. But there was no center available. We have a DOTS program where drugs are distributed to patients, but those drugs suffered because there was a problem in distribution of drugs. Diagnosing of multi-drug resistant tuberculosis. And this is something which has been calculated, that the program itself and the lockdown and the effect of the lockdown will lead to a substantial increase in the number of cases and also number of people who may die because of tuberculosis. And I'm just giving you these two examples, but there are many examples of diseases which suffered because of, or programs which suffered because of the impact of the pandemic. And therefore, we have to now start working on strategies of how do we catch up with the losses that we've had over the last 1 year, and how do we develop strategies that if there is future pandemic or future surge in the cases, other diseases and other programs don't suffer, so that we are able to provide holistic care for people who have COVID and who are not having COVID or who need preventive treatment to prevent other infections from coming. And that is something that we need to keep in mind. So as a nation, there were a lot of lessons that we learned. We learned the importance of healthcare and health both in the public and the private sector. In the early stage, most of the healthcare provided for patients who had COVID was in actually government sector. Government hospitals came forward. There was very few private hospitals which were taking COVID patients because they were scared and there was a lot of stigma and fear. It took a long time for them to really start taking these patients. And that is why I think we still need to work aggressively on investing more and more as far as government sector is concerned, because we need to really improve the healthcare, not at tertiary centers. I'm talking of primary centers, rural India, where we need to have good hospital facilities, maybe a small ICU also, and doctors who are trained to manage that using a lot of technology which is available. We have telehealth now. You can upload or send a CT scan on a WhatsApp from a primary health center to a neurologist in a tertiary hospital. We've done that in our own hospital of a stroke program in Himachal, that the doctor is trained in the medical college in Shimla. And even in any remote part of Himachal, it's a hilly area. If a patient has a stroke, in the government or the nearest private hospital, a CT scan is done. The film is WhatsApp to the neurologist who interprets it and says this thrombolytic therapy can be given, and that is given so that the clot is dissolved and the person can have a recovery during the golden time, where if you treat, you can have full recovery of the stroke. If you don't treat, it will lead to irreversible damage. So we should harness technology and develop strategies, and that is why I think IITs and other institutions can really come together in collaborating with health institutes in looking at how can we use technology for better health in remote areas. And that is something that has really come out of the pandemic. Teleconsultations, telehealth, and even what I would say is using various devices to monitor people. After all, what were we doing in home isolation? Patients were just monitoring the saturation and pulse using a simple pulse oximeter. But we can do that, and we many of us carry what we call Fitbits or devices on our watch, which gives you so much of medical data. Can we not use this to monitor patients who are at risk for diseases? For example, someone who has a heart problem, can we not monitor his heart rate, saturation, or even ECG? And can this not be uploaded so that it can be put on a cloud or someone can look at it? Or an algorithm can be developed so that it can interpret any changes which are happening over a period of time, and that can predict an event even before it happens. All of this is possible. I'm not talking about something which is not possible. It is there. The technology just has to be got together. And that, I think, is what we really realized in the pandemic, that there are a lot of things out there which we just need to work and get them together. For long, we've been working in silos. The medical community in one, the engineering community in one, the computer specialist in other, the mathematicians in another. But science actually has no borders. We all need to come together to develop strategies for improving the betterment of health of the common man. And that can be done if we really harness the power of science in different specialities. So I would say that if engineers, if computational scientists, if mathematicians all came together, we would be able to find solutions which are relevant for our country and which would be useful as far as translational health is concerned, and provide care for even those who are needy in remote areas or even in other cities, by being able to reach out to them and being able to use technology even if the healthcare provider is not there. Looking at the future, if you look at the last 15, 20 years, I think we had enough warning that there would be a pandemic of this nature. I've been involved in this for a very long time, since the late 19s, when I think it was 98, 99, when we had an outbreak of what was known as H5N1 bird flu. Started off in South China, and then we had a number of cases who poultry which had died of H5N1, and then few poultry workers who came in close contact with this poultry also had this pneumonia and died. And this virus has a case fatality of almost 60%. Luckily, it did not jump species and become a virus which can spread from human to human. And that's why we even had a pandemic of bird flu, although this was a big concern in the late 90s and the early 2000. We had SARS. After that, we've had H1N1 swine flu, we've had MERS, we've had Ebola, Zika. All of these have been outbreaks which have given us warning that there are now changes in our environment, which is leading to viruses jumping species, evolving to infect humans, and we need to be prepared for a big pandemic. As a matter of fact, this was something that we've been discussing for many, many years, even with various international institutes in the US. John Hopkins. John Hopkins actually has a model on their website known as CLADEX, which looks at this for the last many years of a pandemic of this nature, but doesn't look at the management. It looks from the medical point of view. It looks at from the administration point of view. If you had a pandemic, what would you do? The whole model says that you are in the US and you suddenly have an outbreak happening in Germany and in Latin America. What would you do? Would you close borders? Will you airlift Americans from this area? Would you invest in making a vaccine? And or would you develop in strategies, or will you just airlift people from Germany and let those in Latin America be because of the difference in the two countries? It's a very interesting model and it evolves. I mean, it goes on to almost 50% of the global population dying because of this. And later on, it shows that it was more of a bioterrorism rather than an outbreak itself. But that model has been there for almost 2, 3 years. And therefore, people have been saying that there would be a pandemic and warning that this is not the end. We will have future pandemics. Therefore, we have to start working aggressively on planning for outbreaks, for surveillance, and I think also start talking of One Health. When we are on this planet, we need to look at health in a holistic manner: health of humans, health of animals, health of plants, health of the environment. All of them are linked. If we are not looking at One Health, then we are not really protecting ourselves. If we are not able to look at One Health, we will have antimicrobial resistance, because if we are looking at antibiotics being given to poultry or to animals, they will enter the food chain. Bacteria will become resistant to those antibiotics. We will eat a lot of the food stuff which has resistant pathogens, and therefore develop resistance as far as these antibiotics are concerned, which is one way of getting antimicrobial resistance. Similarly, a lot of other things feed into this whole concept of One Health, and that also is one of the reasons that a lot of animal or let's say avian viruses will jump species and cause humans disease. So we need to be careful when we look at health from only mankind's point of view. I think we should look at health of all on the planet, and therefore One Health becomes a very, very important concept. Also, I would suggest that we need to develop good networking, surveillance, picking up an outbreak wherever it happens, and having a team ready to see how we can manage that. And invest a lot in research and development. Research for labs which have the capacity to pick up an outbreak, research for surveillance so that samples can be looked at. And that needs to be done aggressively so that we are protected from future pandemics and we have a robust and resilient healthcare system so that health for all becomes a reality. As India moves into celebrating 75 years of independence, I think we should say that universal health should be something for all citizens of India. And if I may end by quoting Mahatma Gandhi, who said, "The future depends on what you do today." So, my dear young students, I think the future depends on what we do today and how we leave the planet as far as the future is concerned. Thank you very much.
Thank you so much, Dr. Guleria. All of us had indeed learned a lot from the pandemic, but your words helped us understand the complexity from a much broader perspective. The evening had been a lifetime experience for all of us. It was indeed a matter of prestige and honor to have all of you. We humbly thank all our keynote speakers for the evening who made all this worthwhile. We would also like to thank our fellow delegates for patiently bearing with us. As we combine all these little steps of ours, we hope NSS IIT Roorkee is able to stand to abide by its motto, not for me, but for the nation. It is with support from all our audience that we were able to make this evening a success. And we sincerely hope